Hey guys, welcome to my channel. So last year I uploaded a video giving you guys tips on how to become a administration officer or how to get into health administration, as obviously I am an administration officer. I would get asked this question like in my everyday life. Like I would get it from people if I went to the service station, which is like gas station in America. Service station, I would get it. I got asked how to get into it if it just came up in general conversation. I got like Facebook messages from friends I went to school with, and I've gotten a lot of questions, whether that's comments on the actual video or private messages or whatever that may be. I've gotten a lot of different questions, and I thought I would make a bit of a video answering some of those questions, because if you have watched the previous video, it was like a sort of vlog and tips on how to get into administration, health administration, then you might have a few more questions relating to it. So I thought I would give you a few answers to the questions. So first question I'm going to answer is, how do hospital managers and hospital administration staff differ? Like, what's the difference between a manager and an admin, like the admin in the hospitals? So I'm just letting you guys know that I am, if you can't tell from my accent, I am Australian, but I also do live in Australia. So all my answers to the questions are obviously based on my knowledge of Australia. It could be very different in another country that you live in, or slightly different depending on what state. I've never lived in other states before, so it could differ a little bit, but it's pretty much, I think it's pretty much the same. But in saying that, it could be very different depending on what country you are in. So administration staff deal with patients and liaise with doctors and nurses, and they're like the front, they're like the front of house role. So even if they're in the back, you know, and they take it like in terms of answering phones or something, if it's in a big like outpatient department, and sometimes they rotate between the front, which is checking in patients and checking out patients, making appointments, all that sort of stuff. And then sometimes the admin out the back, they'll answer the phones, and they will go through referrals and all that sort of stuff. But basically, administration officers are the front of house. But managers, well, what do? They manage, right? So they manage the staff, they coordinate staff. Sorry, my baby's just getting a little bit fussy. One moment, sorry about that, but if I try and find the most perfect moment to film, it'll never happen, because with a baby, there's never a perfect moment to film. Anyway, so, yes, with managers, they manage, right? So so that means that their main focus, their main job, their main role, whatever you want to call it, is to manage their staff. And in the hospital, most hospitals I've worked at, when I've worked at a few different ones doing a few different things, there has been two managers. There's always been two managers, hospital managers at the hospital that I work in, and one looks after the relief pool. The managers manage the staff, and well, they coordinate the staff. So their main role is to coordinate and just follow up on things with this administration staff, like just reports and stuff that they haven't done or whatever. Then they get like, they send us emails, they follow up on things like, you know, they might have like meetings with us if something has been reported from like a nurse, or like a nurse unit manager, or like a team leader, or another staff, like admin staff. You know, they'll be a manager, just like every manager in all workplaces. They manage their staff. So yeah, their main job is to coordinate their staff and make sure that they have adequate staff in the roles that need to be filled, if that makes sense. So they'll manage, like they'll coordinate their leave and all that sort of stuff. Another question I've received is, can I be this if I'm so shy? And of course you can. Even though it is a front face role, you're communicating and you're interacting with people front on, face-to-face interactions mostly. I mean, you still have interactions over the phone. You're interacting with a lot of different people, like nurses, doctors, any healthcare professional workers. Could be dietitians, it could be counselors, sorry, it could be social workers. You know, you're liaising with your team leader, which is a nurse unit manager. You're also talking to patients face to face and on the phone and their family members. But I can tell you that I am an introverted personality type. I still struggle. There's areas that I have, I do well at, but there's other areas that I don't, and I struggle to speak to my superiors, like my managers. Yeah, I can speak to them, but I always have a little bit of difficulty like expressing myself. If I have an issue, I get really nervous and I just struggle a lot with that. So we all have our strengths and weaknesses, and I am naturally a shy person. I won't necessarily just talk to people, so I know it can be difficult and it can be a little bit scary, looking at getting outside your own bubble and thinking about what it would be like if you can do it, if you're shy, what it will be like to be able to be in a role that requires you to speak and communicate a lot. But you know, as much as that's a component of your job, your main job is data. So that's it. That's your main focus. Your main focus is data. And yes, even though you're getting that data, some of that data from patients, the communication isn't as big of a point as data. So yeah, that's your main focus. That's your main job, is data and entering data and all that kind of thing. I hope I'm making sense to you, but I just want to let you know that yes, you can definitely do this if you're a shy person. So next question is, I heard that after college you need 4 years of hospital experience to become a hospital manager. What tips could I get? Okay, so I've actually never been a hospital manager. Like, I've never been a manager before. I've always just been an entry-level administration officer. I haven't applied for any manager positions. But in Australia, you don't actually need any qualifications to get into health administration, and you actually don't need any qualifications to be a manager in health as well. So all the different managers I have had over the years, in the last 7 years I've worked in this industry, all the managers that I have come across have been people who have started as just administration officers in health, and they've just applied for a manager position and they've gotten it, and they might just have worked there for 2 years or 3 years or something like that, right? And they've just been really good staff members. Like, if they were in the relief pool, they would, you know, every time they got called for a shift or an extra shift or something like that, they would like accept it, and they would be like good at their job. The next question is, have you done a course related to this field, like a certificate or a diploma? Which one would you recommend? I have not done any certificates or diplomas to get into health administration. Like I said, I started 7 years ago, and I just applied for casual positions, casual relief pool, because they need quite a big pool of staff, relief staff, to fill the positions when the permanent staff have sick days, when they go on annual leave, which is like rec days, when they go on their additional day off, like RDOs, rostered day off. And the managers need to coordinate staff to fill those positions. And then sometimes the relief staff will go on, like they'll be on contracts. They'll relieve staff, permanent staff that are on secondments. So yeah, so I hope that I have answered all the questions as best I can. If you have any questions, any more questions, then please leave them down below. I would love to answer them. But yeah, if you're interested in this kind of content, then subscribe and hit the bell. If you have any suggestions on any videos that you would like me to make, then please let me know in the comments down below or message me privately on Instagram, whatever you feel comfortable in doing. Until next time, in my next upload, thanks for watching and I'll talk to you guys later. Thanks guys, bye.